Do your wrists and hands and fingers tingle or hurt, especially at night or when you're also working on the mouse or keyboard? If so, stay tuned for the weekly wellness tip. Hi folks, welcome back. Dr. Dean Jacks here. And one of the common problems that really used to see back in the 80s and 90s was carpal tunnel syndrome. So it's just everybody remembers that, and carpal tunnel syndrome, everybody typing on computers when they became more popular, and the carpal tunnel syndrome causing the numbness and tingling in through the hands. And that went away for a little bit, actually about 10 years for the most part. But then the past 3 to 5 years, I'm seeing it much more often, at least 1 to 2 patients a week coming in with carpal tunnel types of symptoms. And what those symptoms are is when you get pain, but mostly numbness and tingling in through the thumb, first, third finger, and if it gets bad enough, it can occur throughout the hands, and sometimes the hands can even swell or swell up, and it's hard for rings to fit and so forth. So the reason this occurs is that the median nerve, what comes right through the wrist, is compressed. There's 8 bones in the wrist here. There's a row of 4 and a row of 4 for a total of 8. And when we lose that tunnel, then the nerve is compressed, and that causes this tingling here. So a lot of people may have surgery or different types of therapies and so forth to relieve the pressure here. But what we do is we look deeper than that, because a lot of times carpal tunnel syndrome can also come from the neck. And what we call this is a double crush syndrome. So double crush means that the nerve is compressed at the neck, and it's also compressed at the wrist as well. So treatment-wise, what we do is adjust the wrist to put the tunnel back in the carpal bones or the wrist. What that does is it frees up the nerve. Then we also adjust the neck from a spinal misalignment standpoint. When we adjust the neck, it takes the pressure off the nerve as well. So this is the best way to get results by decompression by adjusting the wrist, adjusting the neck to free up the nerves so the body can function the way that it knows how, and then we decrease the symptoms of the tingling and the numbness and also the weakness as well. There's different stretches you can do at home. We want to get the wrist moving, but doing stretches to stretch the forearm in both directions. Everything's nice and easy and smooth. You're not jerking up on it, but straighten your arm, get movement in through the wrists. Also, other common problems, if you do have a mouse that's in the improper position, that you're constantly trying to just strangle the mouse on your keyboard or on your computer, you need to change that. Also, doing a lot of push-ups can put a lot of pressure on the wrist. Use the perfect push-ups or use a dumbbell so you can get your hands and wrists off of the floor. So if this was helpful, make sure you share this, like it on Facebook, tell friends and family so they can hopefully get help with these problems as well. And until next time, have a blessed day.